Wonderful to be in this lovely session meant for postgraduates, and to follow NIML's Act is a big thing. I'll be talking about choosing the right fellowship for the postgraduates beyond post-graduation. So first question is, to fellow or not to fellow? How about being a comprehensive ophthalmologist? So you have to first decide whether you want a comprehensive ophthalmology practice or a fellow, or do a fellowship in a subspecialty. The advantage of a comprehensive ophthalmologist is the large variety of pathology that he sees, the flexibility, can practice even in a smaller city, and there may be a financial advantage. A survey of residents by American Academy showed that 2/3 residents planned on applying for a fellowship, 1/3 chose to be general ophthalmologists. And retina and cornea were the two most popular, and a good mentor was one of the most common reasons for choosing a specialty. So when you make the right choice, it depends on three factors: what your career goals are, some other factors that influence your decision, and what options would then you have. The career goals are often decided by your personality, your motivation level, and whether you are an achiever and go-getter or you are the santusht kind. And then, of course, what priority do you give to each of these factors? We look at these. Now, the other thing that matters is what you are eligible for, what is available, what your choice is, and what of that is feasible. Now, when you want to decide about a fellowship, you're going to choose a specialty, and then you're going to choose an institution which you want to go to. So in choosing your specialty, again, your objectives need to be known. Your interest in a particular subspecialty needs to be worked out. You also need to think of what the demand will be for the specialty, particularly in the kind of context that you want to work, and what is the financial potential that this particular specialty will have. So you have to define your objective. You want to do your own practice or work in a teaching institution or in a multi-specialty private institution, what kind of aptitude you have, and what kind of strengths and weaknesses you have. You also need to look at what kind of interest you have, which specialty you have interest in, type of patients you enjoy dealing with, technical procedures you enjoy doing most. Your exposure to the specialty in your residency often determines that. And if you have a mentor or idol in a specialty, that works as an incentive or a disincentive. So let's again look at some of these factors. Define for yourself. Are you skilled at surgery? Do you get tense when you get a nucleus drop to the extent of getting a sleepless night? Do you worry about evidence-based practice and choose an eminence-based practice? And are you fascinated by research or evidence-based medicine? You also need to look at the demand for the subspecialty. You need to look at the changing patterns. This is in relation to UK. We don't have Indian data. You can see that the general ophthalmology trend is increasing in UK, while there is a reduction in the demand for plastics and VR surgery as compared to the previous decade. You also need to look at the financial potential of your specialty. High volume cataract, LASIK were the highest earners, Vitreo Retina next, and pediatric ophthalmology, glaucoma, cornea, neuro ophthalmology in that order. So look at the pros and cons of each specialty. Vitreo Retina will be required in every institution, financially very good, but less dramatic clinical results. Cornea, combining medicine and surgery, immediate results, but you can work for institution or for your own practice. Oculoplastics, large variety, large number of pathologies, working with other specialties. And if you look at aesthetics, possibly a great financial future too. Pediatric ophthalmology, you'll probably need to work in an institution and you should love the specialty. Glaucoma, you need to be more of a physician than surgeon and prefer to work in an institution. Neuro Ophthalmology, you prefer institutional practice and want to give more time for academics, teaching, and research, and finance is not your priority. Uvea ocular trauma, not so much available as of now, and comprehensive ophthalmology. If you've had a weak residency training, you have had deficiencies, then you possibly need to do comprehensive ophthalmology first, and if you want to work in a smaller town. And then look for your institution. Look at the faculty, the infrastructure, the academic program, the kind of hands-on experience it gives you, and what other peers have had as an exposure in that institution. So final advice, during residency days, enter residency with an open mind, spend ample time in exploring those specialties, try and develop a career focus during residency and look at the uniqueness of these. And when finishing residency, list out your short-term, intermediate, and long-term goals. List out your priorities. Discuss with trusted mentors and peers, and spend some time as an observer with a mentor in a specialty. But above all, use common sense. Thank you.
Thank you so much, Dr. Ashok Grover, sir. Dr. Debashish Bhattacharya, sir, you are there? Dr. Debashish Bhattacharya. Meenakshi, ma'am.
Yes, again, lovely talk. And say hi to Pooja before I forget. Yeah, and lovely talk, Ashok, as always. And I just wanted to very quickly add, over the years, over the last 15, 20 years, that's one of the most biggest decisions for postgraduates as they are finishing is to whether to do fellowship or not do fellowship. If yes, which one? And where is a very big question for them. I just wanted to, since again this is targeted to the postgraduates, I wanted to just suggest that number one, by about the third year, you have some idea what you definitely have an idea what you don't like, and you have an idea about 2 or 3 things of what you may like. Yes, and then you can start, now there is a plethora of webinars. There's a plethora of content online that you can participate, start exploring, and see if this is something that excites you as a postgraduate. The second thing I would say, once the pandemic is, in control and the observerships are allowed again, if there is a gap between your postgraduate completion and fellowship starting, request observerships. Most people are willing to allow you to come. Many are even willing to allow you into their theater. So for instance, if you've had very little oculoplasty exposure during your PG, which is not unusual, sometimes in some of the national board hospitals and even our medical colleges, you may not have seen the whole gamut of whole variety of cases. So in such cases, you ask for a week's observership, go hang out in the OPD, go into the OT, see what's going on for yourself. Sometimes that is extremely helpful to decide whether this is your thing